Good evening.
Good evening to you, Ginger. The impacts not only being felt here in San Diego, but across the rest of the state tonight. As you mentioned, supply, it remains scarce when it comes to those COVID-19 tests, and it takes time to get those back. It's all why families and advocates say these new requirements all but bar them from being able to see their loved ones. CDPH says these new laws, or new requirements rather, are in effect to meet the rising demand of COVID-19 and the cases we're seeing spread across the state. But so many others feel this is detrimental to nursing care facilities and as well those patients who are getting care there. Erin Popka is one of countless Californians caring for a family member in need.
So my father is in a subacute long-term care facility.
An accident last year left her father with a severe brain injury. This photo taken weeks before the accident. This one just days ago. His condition requires additional essential care provided by his family.
It's very devastating that they've pretty much taken away visitation to nursing homes again. It's devastating for the family members and caregivers, but more so even for the residents in these facilities.
Visitors must show full proof of vaccination, booster shots, and a negative COVID-19 test. A rapid test is required within 24 hours of the visit. PCR tests have to be taken within 2 days. Requirements that Erin calls unsustainable.
I'm a business owner and I have to try to work, and I can't navigate standing in line and trying to work a schedule that's constantly changing for visitation.
Test shortages, long lines, and even longer wait times to get those results back has left many desperate.
We were outraged given that CMS, which is the federal agency that oversees nursing homes, they have loosened all restrictions for visitors.
Pat McGinnis with the California Advocates for Nursing Home Reform criticized CDPH for ignoring federal standards. She said nursing staff is not being held to the same standard as visitors.
This is a terribly, terribly dismal policy on the part of the department. It is absolutely unconscionable in our terms, and they need to lift it immediately.
Citing nationwide statistics that show denying visitors directly contributes to the morbidity rates of residents in long-term care facilities.
I can tell you that visitors provide the majority of the care for residents anyway, and they're not even there now. So God help anybody who's in a nursing home today when they're dealing with the lack of staffing.
It's exactly what countless families are facing across the state.
We are his voice and we are his advocates. And when the state takes that away from us, he lays there with nothing.
Erin is pushing for the passage of the Essential Caregivers Act. This is a policy that's in place in a majority of other states across the nation. And what it does is provides to either caregivers or family members the same level of access to their loved ones in that facility as those who work there as staff. So that would mean that 2 of those caregivers would be allowed to be inside regardless of this public health emergency, which CDPH has put into place, which is why they are able to supersede those federal mandates. But again, this is something right now that so many families are trying to grapple with, trying to figure out how they're going to get their hands on one of those tests. Erin telling me she spent $200 yesterday. She plans on doing that again tomorrow, all in hopes of being able to give her father, she says, the care that he deserves. We're reporting live tonight in Kearney Mesa. Hunter Sowards, KUSI News.
All right, so Hunter, these new guidelines are in effect until February 7th. Is there a chance that they could be lifted sooner?
Well, right now, Ginger, the rumor is that these will actually be extended beyond that February 7th deadline. Right now, we know that there are a number of people, those advocacy groups, who are calling on residents to contact the state, to contact health officials, the ones that have directly put this new mandate into place, to tell them that right now, with the current state of Omicron variant, that there are ways to safely allow visitors, especially those who do need to provide that critical care that would not otherwise be done, that this is meeting a moment of staff shortages, allowing those family members and loved ones to even help, not hurt the situation. So right now they are pleading with the public to contact representatives, to contact the state, and hopefully make them see the detrimental effects that they feel could be had on this situation if it continues beyond that February 7th deadline. Ginger.
Oh, why do I feel like that extension is already in the works? That seems to be the way this has played out. But